in the meantime, the question is about a 2020 playing season. What will it look like in the NFL in the world of COVID-19? I have in my hands 9 pages that was kind of the meat of the league memo that went out to all 32 teams about protocols for the 2020 season, facility protocols when players are expected to be back, hopefully, later on this summer. And the chief medical officer of the National Football League, Dr. Alan Sills, we paged him. Did he call in, Chris, paging Dr. Sills?
Oh, yeah, he's on.
Dr. Sills, how are you, sir?
Good afternoon. I'm doing great. How are you?
I am doing just fine. Let's get right into it here, Dr. Sills. What would you want fans to know about these 9 pages that I'm referring to, the club protocol portion of the memo that went out yesterday?
I would want everyone to know that a tremendous amount of research and review and discussion and collaboration went into that. We had a number of joint task forces that were set up between the NFL, the NFL Players Association, bringing together medical experts, infectious disease experts, team doctors, athletic trainers, players, all those voices putting together to really think about what's the data telling us, what is the science showing us, and with one simple goal in mind, which is how can we mitigate risk and try to keep players, coaches, and staff and everyone as safe as possible during this pandemic while we approach our season.
Well, it seems the spine of this is to place personnel into a tier. There's 3 tiers. I'll give you the floor on what those tiers are for you to explain to people.
Well, I think what we recognize is that you're going to have really not just consideration about players, but an entire team environment of people that are going to be together every day. So it's players, it's coaches, it's support staff, it's medical staff. And those individuals are going to be in and around the facility and also on the practice field. And when you're in your facility, certainly you can wear a mask, you can space things out, observe physical distancing, some of the standard public health measures. But when you get on the football field, we all know that football and physical distancing really don't go together. So in that sense, those people who are in that close tier together, those first 2 tiers, share risk with each other in terms of transmission. They also share responsibility in the sense of what they're doing off the field and away from the facility to make sure they keep themselves as safe as possible. So all of those individuals that we like to think of as one ecosystem where, again, they're going to have many of the similar risk factors and the same factors around transmission. So we'll be testing them and screening them and caring for them and trying to protect them in the similar way. It's also important to note that we want to limit the numbers in that because obviously the more people that you bring in, the more you increase that risk. So we've asked clubs to really work with us on that and determine how many people really need to be in sort of those inner circles of people that will share those day-to-day risks with each other.
Well, and in terms of that, Dr. Alan Sills, I mean, you take a look at a training camp and the number of people, just players alone, can number well above what any locker room could handle when you've got to make sure that lockers are a certain distance apart. What are you and the league instructing these teams to create extra space? I mean, how are you going to handle that sort of thing?
There's no question that this is going to require a lot of challenging and thoughtful and creative solutions, but we have done indeed just that. And we've talked and worked with teams, and part of sending these protocols out is to give them the chance to prepare and to think about those things. I think one of our team athletic trainers summed it up best. He said, this is not going to feel or look normal because it's not going to be normal, meaning that things that we've become accustomed to, our day-to-day routines, whether it be the layout of the facility or how we conduct meetings or how we conduct practices, all of those things are going to be likely to change this season, and they're going to change to try to mitigate risk and to keep everyone safe. So there will be a lot of accommodations that have to be made, and again, that's things, for example, taking meals together. You know, players would typically come in and staff would all eat together in one area. You know, we have to change how that's done, not only how the food's prepared and distributed, but how people actually consume it. So basically everything in the operation of the team is going to have to go through that thoughtful review through the lens of how can we mitigate risk and make this as safe as possible for everyone.
Right, and there's, you know, obviously we're hearing other leagues that are trying to do this, talking about creating a community where everybody's in one spot. The NBA in particular talking about Disney World right now. We'll see what the NHL comes up with, but the NFL's not going to do that, right? I mean, there's going to be just one facility that everyone's going to be at for training camp, and then the playing season is just going to be. What are you telling the players going into the playing season?
Well, again, we have a lot of communication regularly with our colleagues at the NFL Players Association, but we all did not feel that we could take a 6-month season, which is what our season ends up being, actually more than 6 months when you add in training camp, and ask everyone to stay isolated at one location, away from family, away from social network support structure. I mean, that just felt like an impractical request. And additionally, you can't keep people locked down endlessly and create some type of sterile environment. So we think that it's a better approach is to do all that we can to mitigate risk within the facility and within the areas of football, and then to do a lot of education for all the stakeholders that what we do away from the football facility also really matters here. We have to really continue to follow the best practices in terms of wearing a mask, frequent hand washing, social distance, physical distancing, these types of things, because that's what's going to help us all keep each other safe. And then we'll layer in with that an aggressive screening and surveillance testing program should someone be exposed or contract illness either outside or inside the facilities.
Where are you on that subject right now?
Yeah, we're in very active discussions, again, among all of our advisors and in the league and the Players Association together, and I'm optimistic that we will see some updates on that in the very near future. Again, we have to recognize that this is very much a moving target, and all of these protocols that you talked about, they're going to have to be very flexible and adaptable because our knowledge is going to continue to change. We've got a long time from now to the start of our season, and we're going to learn a lot more about this virus. We'll learn a lot more about the pandemic. We should take that knowledge and make sure that we're updating and modifying those protocols to reflect the latest and best science.
Now, I know, Dr. Sills, that you're a doctor. You rely on science. You rely on science-based conversation. But where do you in the league want to be? I mean, do you want to be in a spot where it's just if somebody does test positive for COVID, they're just removed for a couple of days, depending on whatever the CDC requirement will be for quarantine at the time? Where do you want to be in terms of keeping a league going when a player tests positive?
Well, where we want to be is squarely in line with the public health guidance. I think you've seen throughout this pandemic that that's been our strategy. And, you know, you could look back, for example, to the draft and see that the challenge that we took upon ourselves was how can we conduct this draft but still do so in accordance with the current public health guidelines and what's being recommended to keep everyone safe, and also model that best behavior. So we're going to take the same approach here. We will have a very detailed protocol for if someone tests positive, how they should be isolated, how should be treated, and how they may eventually return to play. But I think, and we've said this repeatedly, we expect that there will be new positive cases as long as this disease remains endemic. That doesn't mean that our protocols failed or that someone didn't do their job on their personal responsibility. As long as this disease is endemic, there'll be new positive cases. And so our goal is to identify those as quickly and early as we can in the infection window, remove those individuals away from everyone else to keep everyone else safe, and then make sure they receive the appropriate care, and then return them to competition or to their role as soon as it's safe to do so.
So is it going to be sort of like, for the lack of a better phrase, I know you're a neurosurgeon, you know about the concussion protocol. Is there going to be like a COVID-19 protocol where somebody has to pass to come out of a COVID-19 protocol?
Absolutely. I think that's a useful analogy. And, hey, I always appreciate you putting it in terms I can understand as a neurosurgeon. But
that's all I got. I got nothing else for you on that. I can't go any further than that.
I think that's a helpful way to think of it is, yes, there will be a roadmap to follow and make sure that everyone receives that appropriate treatment. And again, that will be constructed not only in conjunction with our medical staff, but what are the current CDC and other public health guidelines, as well as what our experience has been from other leagues. I think one other important thing to point out here is we're in regular communication with other pro sports leagues, certainly throughout North America and around the world, and we're learning from each other about their initial experiences about how to return sports and how to conduct these protocols. So all of that will help inform those decisions. Then
obviously testing is something that you're still formulating. Is the idea to have point-of-care testing where somebody comes to work, they are tested every day or every other day, and the results are as accurate as possibly can be, but back in hand within minutes? What's the goal there? Yeah, I think that's a useful overall construct. We're still determining what the exact schedule would be. But again, obviously we would like to test people frequently. And this is what we would call surveillance testing, meaning these are asymptomatic individuals. We'll have a screening protocol so that if someone has symptoms, we're obviously going to isolate them on symptoms alone.
But we want to have a surveillance screening testing protocol that allows us to test all individuals in those tiers that we mentioned before on a very frequent basis, so that we can hopefully detect someone as early as possible with a new infection, hopefully even before they're manifesting symptoms, so that we can, again, remove them and isolate them, as you said. So that's the goal of a testing program. It will be done on sites local to the team, and the results reported back, so that, as you said, we make sure that anyone who's coming into the team environment has indeed been cleared. And I think you extend that also towards game days, where you want to make sure that everyone, as they come to participate in the game, has gone through a similar type of testing.
What are your plans? Are there plans to outfit face masks with actual N95 material? There's talk of that being possible, that every face mask has a mask built within it. Is that possible?
Well, I would say we're exploring a number of different options, again, very collaboratively with the Players Association. We have a number of consulting engineers that we work with on both of our groups. And so all ideas are on the table and all options are being looked at, because, again, our goal is to mitigate risk as much as we possibly can. So I would say we have very active discussions about those types of devices, and we continue to see what makes the most sense and does the best job for mitigating risk for our players while still being compatible with the game of football.
I also couldn't help but noticing with Tier 1, again, in this club facility protocol for the 2020 season, Dr. Alan Sills, a couple more minutes left with the Chief Medical Officer of the National Football League. I couldn't help but notice that it wasn't a requirement that masks be worn by players, coaches, athletic trainers when they're around, because it is specifically mentioned for Tier 2 individuals. Are you planning on just saying, you know what, players are around each other and within the facilities, they're not going to be required to wear masks?
No, that's actually not what we said initially in most of these protocols. We've stated that masks are not worn on the field during the athletic competition for those Tier 1 individuals. But when they're in the facility, if they're in meeting rooms, if they're in dining areas, we do anticipate that masks and other PPE will be appropriate. And I think that's one important point. Sometimes people say, well, gosh, if I'm being tested, maybe I don't need to bother with all that. And we don't feel that way for several reasons. First of all, no test is 100% accurate. There are always, some things that are not going to be caught by your testing program. And secondly, the time development, the course of symptoms, and when someone's infectious, is still to be worked out. And thirdly, again, the responsibility of others in the testing environment. So I think that, just because someone's being tested doesn't mean they don't need to wear PPE. The real thought behind the testing is there's certain situations in football, as we've talked about on the field, where PPE can't be fully worn, and so there is some risk exposure there. And so that's the thought why the testing adds in some extra layer of safety above which PPE alone would.
Well, I'm glad, I wanted to bring that to the fore. You gave the answer that you gave, because so many people do look to the NFL for leadership on so many different fronts. And I'm talking about society in general. And that's important for people to know about wearing masks writ large as we go about our businesses. Even if you've been tested, that doesn't mean that you shouldn't wear one. So I guess my last question for you is, what can you tell people who are reading about possible therapeutics? I imagine you are on the front lines with the NFL in connecting with drug companies and finding out whether there could be some sort of medication that's either out there as a drug that's being used for other purposes right now that could be repurposed to help the fight of COVID-19, or even shorten the amount of time that somebody could be within what we just established, potentially a COVID-19 protocol. What can you tell people about what you know about therapeutics for the fall?
Well, I remain very optimistic that we're going to see some major advances made in therapeutics, and really in all these areas. And I think one point to keep in mind that's related to that is, I know that for all of us, it feels like since we started this, when everything shut down with the first positive cases, that feels like, roughly 5 or 6 years ago?
You're right.
I mean, it feels like a very long time. It's actually only been about 3 months. And there's an equal amount of time, or a little more time, in fact, in front of us between now and the start of the NFL regular season. And so the point is, think about how much we've learned, how much knowledge has been gained, how much more we know today than we did early in this pandemic. I'd expect us to make similar jumps in knowledge, because there's so much work being done on therapeutics, on testing, on the epidemiology. And that work is certainly going to inform us. We're going to keep that on the forefront, and I'm hopeful that some of those therapeutics indeed will come into play. But again, we're just going to have to let the medical science work its way through. 3 months is a very long time to us to stay at home and to isolate. It's a very short time in the scientific world for development of things like vaccines or new therapeutics. So we'll have to remain patient, but we're certainly monitoring that very, very closely.
Okay, and I guess then that's my last one for you. You mentioned vaccine. So many people out there want to know about fans in the stands and whether they need one to feel comfortable returning. Where are you on that subject with fans in the stands and your expectation of a vaccine potentially in time for, let's just say, a playoffs for an NFL season in 2020?
Yeah, I think it's really hard to predict when a vaccine may be available. I mean, vaccine development is a lot tougher than people think. If you've been around the medical world for a while, you know that there are a lot of starts and stops with that. And so I think that we will get to the point of having a vaccine. It's just very, very difficult to put a timeline on that. But I think that will certainly get here. I think in the meantime, as far as fans go, we've expressed repeatedly we would like to have fans be present if it's possible to do so, meaning if it's safe to do so. So, again, we'll continue to work with the public health authorities. We'll look at what the state of the knowledge is. We'll be informed by what other leagues around the world and in our own country have learned and have done in that regard. And we'll make the best and the safest decision at that point in time. And as we mentioned before, what happens in September could be very different from what happens in January. We'll just have to continue to be flexible and to adapt as new knowledge comes out.
All right, Dr. Sills, I appreciate it. Thank you. I don't know if I could put anything more in neurosurgeon terms or doctor's terms. I did my best in this conversation.
You did a great job, and thanks for having me on.
I appreciate you saying that. Thank you. That's Dr. Alan Sills, NFL Chief Medical Officer. Hey, you watched all the way to the end. Thanks for that. Watch more right here.